prolonged exposure to these devices can actually result in eye strain, can actually result in eye strain. Okay. It can also result in what we call dry eye. All right. Dry eye. It can also result, it can also result in neck pain, back pain, and even headache. Okay.
Okay. So, so wait. Somebody may be wondering why it's called vision computer vision syndrome. What is computer vision syndrome?
Okay, so computer vision syndrome is an eye related problem caused as a result of prolonged exposure. That word prolong, long use of the computer and other digital devices. So basically, computer vision syndrome has to do with an eye related condition as a result of prolonged use of the computer.
So that means, wait, let me break it down for the simple man to understand,
Please
doctor.
do.
So it means if you spend more hours on your telephone,
Yes, on your
on your
computer,
computer,
even your TV
on your
screen,
TV, watching
tablet.
Filipino show, season one, season two, season three, season four, season five, you can't sleep. It has effects on the eye, right?
Yes, it does.
Okay, okay, okay. We learn you. So don't forget the numbers for you to call is 0777-907-907 Her name is Dr. Halima. She is one of the doctors at Healthy Youth Therapeutic Center right along the GSA Road after the second speed breaker coming from the main entrance. And this program is sponsored by Lucky Pharmacy, your best dealer in all your health related medication. So visit the clinic. And the good thing about the clinic, all of the tests, is it still 1005?
Yes.
Okay. So to run all of the tests is 1005. They also treat diabetes, they treat stroke. But for this doctor here, she is specialized in the eye. And today we are talking more about your eyes. Okay, so cataract, and I right pronouncing your pronunciation right. Yeah, okay, let me see. Somebody's trying to put you the call. Yeah, there's cataract in that serious national anthem. Almost everybody in the country. Every clinic you go to, you get cataract. Yeah.
All
So let's
right.
take this person quickly.
Okay.
Yeah. Hello? Hello? Uh, so the doctor is on the radio, okay? The doctor is on the radio. Okay, so let's continue the questions, right?
All right.
The numbers for you to call to talk to her if you got questions. 077-907-907-087-111-107 0 one. Somebody said they've been texting from River G. Okay, thanks for following the broadcast from River G. Wow, which part of River G? All right, so let's. I got another question, Doc. We've been on this teaching for past 2 months now, and you've been dealing with different topic. Now, does the light from the laptop, for your computer, for your phone, does it have any effect on your eyeball?
Thank you for that question. Now, there has not been any research to prove that the light coming from the computer, the tablet, the TV screen, or even the phone has effect on the eye. But prolonged exposure to these lights can actually result in other health related eye conditions.
Okay.
Yep.
Okay, I'm trying to set your camera right. Okay. Yeah. All right, so more questions here. I wrote a lot of questions for you today. Okay, so we're about to go to the glaucoma, and the cataract. We're
Yes.
about to go to the glaucoma and the cataract. So okay. Firstly, what is this whole cataract? What's the difference between the glaucoma and the cataract?
Okay.
Yeah.
Okay. So,
Okay, come let's take this person. Let
okay.
let get hello. Yeah, your name, where you join us from?
Okay.
Yeah, go ahead. That you calling for Roger? That who by Roger you calling from? Oh wow. Okay. Yeah, go ahead. Talk to the doctor. Yeah, talk. So my man, let's also why have the person got report to do now? Why have the person got a lot of hustle? You know, some people they gotta find report, do some documentation, prepare some paperwork. So I understand what he's saying. So you got any question for the doctor? Yeah. Okay. All right. All right. Thank you so much for participating. All right. So doc, my
Yes.
other question, right? I hope I'm not boring down too many questions.
No, it's fine.
Yeah. Okay. Thank
We're
you.
talking about cataract and glaucoma,
Yeah,
right?
the difference. Yeah, difference between. Yeah.
Okay.
Yeah.
So, glaucoma is caused as a result of increased pressure inside the eyeball. You know, the eye has water.
Okay.
Let me
Yeah.
make it as easy as I can. The eye has water. All right. So, the amount of water coming into the eye and the amount of water going out of the eye should be balanced, if you know what I mean.
Yeah. Yeah.
Yes.
Yeah.
So therefore, some people, it gets to a point where the pressure inside the eye is high, meaning the amount of water going into the eye is higher than the amount of water coming out of the eye. So increased pressure inside the eyeball results in glaucoma, and glaucoma causes blindness, total
Okay.
blindness. Nothing can be done about it. Causes total blindness. But for cataract, cataract has to do with the lens. Remember the lens that is needed for an individual to be able to read tiny print?
Yeah.
Yes. It gets to a point where the lens is not as clear as it's supposed to be. It becomes cloudy. So the cloudy lens is what results in cataract. But cataract can be treated only by surgery. There is no eye drop, there is no medicine that can take away cataract, only surgery. So I'll put it this way: cataract causes temporary blindness, while glaucoma causes permanent blindness.
All right. All right. Today we are in conversation with Dr. Halima. And Dr. Halima is one of the doctors at the Healthy Youth Therapeutic Center on GSA Road. So when you coming from the main junction of GSA Road, the second speed breaker, opposite Pastor Solomon Goet Church, Pastor Goet Church across the road, you'll see the signboard there. It's called Healthy Youth Therapeutic Center. They do a lot. They do a lot of different. They got a lot of doctors in the different fields. Like they treat stroke. So if anybody that got stroke, right now you go to the hospital, doctors are there already. Right now, not to speak, you go to the hospitals. Any hospital open?
Yeah, we opened.
Okay.
Yes.
So right now you go
It's
there.
24/7. But
Okay.
for the eye, it's daily.
Okay. Oh
The
yeah.
eye is 9 to 4.
Okay.
But for the other part, it's around the clock.
All right.
Yes.
So where you suffering from stroke, you can stop there. If you're not feeling well in your body, go there and run all of your tests. All right. Don't allow the car to break down before you take it to the garage. Because that mechanic will overcharge you.
Yes.
Yeah. So it's better, even though you're feeling fine, right? You're feeling healthy in your body. But I always advise people frequently go to the hospital to do tests. To make sure that you're okay in okay. Because now you may be okay, but
Okay.
you're not okay. Yeah. So let's take a few calls quickly. Trust me, I've rated close to 50 questions for the doctor. But my mom can ask all of these questions. All right. She's been around for the past 2 months. She's
Uh-huh.
been teaching you. So I know you learned something. I know there's some questions you want to ask. Or when you got issues with your eye, there's the right person that can answer all of those questions. I'm not in a position to answer it. So she here, she have studied about the eye, she have treated people for the eye. So where you got issues where your eye just red, your eye just burning, your eyes running water, you can see clear. When I ride motorbike whole day, you're supposed to add to dust.
Mm-hmm. Mm-hmm. Yes.
You're supposed to add to dust. And I think red, that's why you get high. Call it after you tell you what to do.
Yes.
Yeah, so let's talk to few callers. Hello, hello. Good morning, sir. Your name, where you join us from?
Okay.
Okay, go ahead. Talk to the doctor.
Yes. Too much what?
Too much weeping, crying.
Okay. Mm. Okay.
Oh, okay. Keep following the program. Thank you. All right, 077-907-907-087-111-107 are the numbers for you to talk to Dr. Alima. We still got more questions here, so I want to afford you the opportunity. I can be the one asking all of the questions, all right? I know some of you have gone to the hospital and told you got glaucoma. I know some of you have gone to the hospital, you got cataract. I know some of you just in that eye running water. I know some of you know diabetes all can affect the eyeball. So a whole lot of things we can talk about. Let's take this person quickly. Hello, hello. How you doing? Your name, please, and where you joining us from?
Okay.
All right, talk to the doctor, please.
Okay.
All right, what caused the eye to be itching?
It's
All right,
age, please.
all right.
It's age.
Okay, okay.
How old are you,
Your
please,
age,
sir?
how old are you? Hello?
He's left.
Oh, yeah, yeah, yeah,
It's
yeah,
okay.
yeah. All right. So, 077-907-907. And the clinic can treat people with diabetes too?
Yes.
Diabetics?
Yes. We
All right.
treat every aspect of the body.
Okay, all right.
Every aspect of the body. Yes.
All right, so this person asks, what is the cost for? Is it the 1,005 for only the eye or
Yes. The 1005 is for the eye. We
only the
do
eye?
the examination for the eye, and then we will now tell you if it's glasses you need, if it's eye drop you need, or any other change in lifestyle.
Okay,
Yes. But for the other aspects, you pay separate amount. Yes.
okay, all right. So, okay, I take this person. Hello, hello, ma'am. Can you just walk away, please, please, please? Oh, she hang up.
Yeah.
Hello, hello. I'm great. Though your name, where you join us from? Okay, talk to the doctor. Your name. Talk to the doctor, please.
What were you sick of, sir?
Why was you sick? Why was you diagnosed of? What kind of sickness doing you?
What did he say?
African sun, fire goa. Affected his The doctor said confused though. She said, what do you mean? Why you call
Okay, don't
African
worry.
sun?
We'll talk about it here and just let it be.
Alright. How old are you?
Yes, what age? Thank you.
Hello? Alright, 45. Should address
45.
that. Yeah.
Okay.
Should address that. You're welcome. 077-907-907-087-111-107. All right, so I got two questions quickly, and then you start to answer everything. Doc,
Yes.
does glasses damage your eye?
No, it doesn't. Glasses doesn't damage the eye. Glasses
Oh,
only improves your vision. It's like a man who can walk, right? When you give him the walking stick, Mr. Rennie, I'm the one asking you now.
I listen to you. Yeah.
Yes, a man can walk very well, right? And you
Mm-hmm.
give him the walking stick. What does the walking stick do for him?
Okay. To help balancing.
Thank you very much. That's the word balance him. And then sometimes he puts his extra energy on the
Yeah.
stick. That is what the glasses do for a man who or a woman who needs a
Then
pair of
why is it
glasses.
Lobo J for the glasses?
It's knowledge. They don't know. That is why
Okay.
we're on radio to educate.
Okay.
They don't know.
A lot of boys for the glasses.
No, not at all. It's like that walking stick helping you to improve your vision, you
Okay.
know?
Okay.
Just the way the walking stick helps the man to walk a bit better.
Okay. Okay.
Yes.
I specialize in it at the you say this clinic name because go there. It's about lucky feminine buying one.
Not glasses. Eye drops
Oh, they don't
and
sell
your
glasses
tablets.
there?
No, they don't.
Oh, okay, all right. No, Lucky Pharmacy is a big,
Yeah,
a big
yes.
drug distributor.
Yes.
Anyway, so go there, you buy all your medication, and then because the more you do business with Lucky Pharmacy, the more Dr. Alima will be able to raise money to pay the radio station for her program. She's now working with Blaze. The 50,000, 100,000 can get she gets one. She not, yeah. So the 100,000, the 50,000 give you but she gets one. She looking for someone outside girls. So please go to the clinic. When you pay for the examination, when you run all your tests, she'll be able to generate money. She'll be able to do some research. She'll be able to do some tests. Listen, you got to empower people who got the ability to solve certain kind of problems, to be able to solve that problems timely. Imagine you go to the clinic and no gas to put in, no current. You know how embarrassing it is. But when you can empower somebody that can solve problem timely, trust me, like the world be a better place for every one of us. We can't be mean to ourselves. Yeah. And I'm not begging you for money. I just say go to the clinic, pay for your own checkup. Then they service your entire body.
Rennie, service your entire.
Yes, seriously. Ah, before you walk in the street, you fall up, you think that hunger game. You just break down in the streets. I'm hungry, but I will. Okay, so 077-907-907-087-111-107. We're about to go to this whole glaucoma and cataract discussion. And I'll give you the opportunity now to call because when I start to ask my questions, so you can call right now to ask your questions. She'll answer everything. She's taking notes. She's taking notes. She'll answer everything. All right, Doc, say no calls yet. Let's
Okay,
get to.
let me quickly answer the three questions that came.
Okay, yeah, no
Yeah,
problem,
the
Doc.
first caller asked if too much crying can affect the eyes. Sir, to your question, yes, it can. Yes, it can. I won't say too much, but yes, it can. The second caller from Habel said, and what causes itching? I was trying to get his age before the call ended. Sir, itching can be caused as a result of environment, okay? And even the kind of food you eat can also cause itching. But quickly, let me say this. Generally, for growing children, there are four things that can cause itching. I like talking about this, okay? You have cold, heat, dust, or smell. So let me explain. For some children, some adults too, it's during the raining season. During the raining season, like the rains have started, children, they express discomfort by sneezing, itching the elbow, including the ears. Okay, so for those children, their allergy or what triggers the itching is cold. Okay, for other children, it is during the dry season when the weather is hot and dusty. So when the environment is hot, they also express discomfort by itching and even the dust in the atmosphere. And then the fourth one is smell. Under smell, we can categorize it as discomfort coming as a result of perfume or even air freshener. So for these children or for such persons, when they perceive any smell they are not comfortable with, they begin to itch the eyes, they begin to itch the ears. Some children even have running nose, water coming from the nose. So, sir, I do not know your age, but if this question is related to you, it can be as a result of your environment, okay? Itching as a result of your environment, environmental factor. The third question came from, I can't remember the man. Is it Liberty Community?
Uh-huh.
The third caller. He said from the Liberty Community. I can't really pick where it come from. But the third caller asked that he has tearing.
Yeah.
Tears constantly comes out of his eyes, sir. And he said you're 45. I forgot to ask you, sir, the kind of work you do? What is your occupation? Okay, what is your occupation? People who experience what we call the dry eye syndrome, although we call it dry eye syndrome, they also have tears coming out from their eyes. All right, Mr. Rennie, over to you.
Okay, okay. Blaze Radio 19 to 7. Don't forget the Blaze Cash giveaway still here. Radio is audible time. Continue to play 10 times. Star 799 star 9 hash. You press number 2, you press number 10, you put in your pin code. That will give you a chance to win money right on the radio. So before I ask my question, let's take this call quickly.
Okay.
Hello, how you doing?
Okay. I didn't get that.
So she's asking which position is okay to sleep. Whether the light should be on when you sleeping or too much sleep can affect your eyes. And that's it, ma'am. And that's the question. Okay, triple
Questions.
seven nine. Yeah,
Okay,
yeah.
sorry.
Two questions she
Sleeping
has.
position, light on or off. What the other one?
And the next one, if too much sleep can affect
Okay.
your eyes. 7111107. Dr. Alima works at the Healthy Youth Therapeutic Center. The clinic is located on GSA Road, coming from the main entrance. They see diabetes, they treat stroke, they treat different health issues with different international doctors. Now, Euro. This is not Euro. Yeah, yeah. So go to the clinic. You see different international doctors there. They will be there to treat you. And for her area, if the entire eye examination is 1,500 Liberian dollars. All right. But go to the clinic. You got a diabetic patient, take that diabetic patient there. You got a stroke patient, take that patient there. Let's take this person quickly.
Okay.
Good morning. Ma'am, can you just walk over the radio, please? Thank you so much.
Okay.
Okay. Okay,
What she
ma'am.
say? Okay. Okay. Mm. That's a good
Yeah,
question.
yeah, yeah. But you answer it, yeah. Hey, you get use shares? You get use shares? Or
Hmm?
I eh?
Wow. Wow.
She will answer that, but you thought about that before. But you answer you okay? All right. Yeah, smart student. You thought about your answer. All right, let's go quickly. 077 907 907 107. Guys, don't forget about the cash giveaway. I see people not playing. Continue to put in your ticket. As soon as Anil comes, she will start to give out 40,000, 30,000, and 20,000 on a broadcast. Okay, it's just 100 Liberian dollars when you dial star 799 star 9 hash. You press number 2 for Liberian dollars, and then you put in the number of tickets you can afford. All right, so let's take full questions. All right, so doctor, I want to ask a question. Right,
Okay.
can high blood pressure become another national anthem in the country?
Mm-hmm.
High blood pressure, high blood pressure. Can high blood pressure affect your eyes?
Yes, I high blood pressure can affect the eye. You know, the eyeball is about blood vessels.
Okay.
So what happens to who have and they never in their eyes? By the time we check the eyeballs, we see signs pointing that they have diabetes and high blood pressure. So from there, We let them know that yes, you have this, and they begin to treat. So there are certain signs we see inside the eyeball to tell if a person has high blood pressure and sugar or diabetes. So to your question, yes, high blood pressure affects the eye and it results to what we call ocular hypertension. You get it?
Okay, yeah.
Ocular there means eye. So when there is high blood pressure in the body, it results to ocular hypertension in the eye. So to your question, yes, high blood pressure in the body can affect the eyes.
All right, so yeah, that good respond to the question. Oh,
Okay, let me. Okay, that's fine. All right. So the I think Hawa Maggie, right?
yeah.
She said, sleeping with light on or off. Off. Let me not say plenty. Sleeping with the light off can have is good. Is better. Sleeping with the light off.
Okay, sleep with the light
Light off
off.
is
Okay.
better. Okay. Did she ask any other question?
If too much sleeping
That's all.
no, she asked if too much sleeping can affect the eyes.
Yes. Sorry. Too much sleeping can affect the eyes. Let me quickly say this. With our eyes exposed, right? You know, oxygen. Oxygen is actually coming to our eyes when our eyes are open. So oxygen is good for the eye. But when our eyes are shut, Mr.
Yeah,
Rennie,
yeah.
when our eyes are shut, that oxygen is cut off from the eye. And the oxygen is needed by the eye. Another thing is, right, is that so in cause increase in the eye result. So to her question,
Well,
yes, increased pressure in yeah, increased pressure.
wow, wow, wow. A problem. They're like, right. All right, so yeah.
Can I go a little bit? Let me rest it.
No, but
I know, I
but
know.
anyway, okay, no problem. Yeah, you're gonna get on it. Okay, credit center is here for you. Halima works. Medical facility treat so many different. Do a lot of kind of breakdown before you carry it there. Because let's see, the mechanic man will charge you for all the imagine high blood pressure, okay, for the apple. So when they can't break down when they can't break down before you carry that, they will charge you for high blood pressure, they will charge you for the apple. So you better you go do your blood pressure test possible.
Mm-hmm.
Yeah, you do your pressure before you get affect the apple, you know, yeah, you do your pressure, then you check your sugar, you know, you check, oh, it's supposed to be there. Supposed to be there, infection, okay, break you down. So go to the clinic. So if you want to know where the clinic is located, and the clinic run 24/7, in the night you can go there in the morning. And this time is the best time. Because one of the teachers he said that it's good to go to the clinic to do tests when you haven't eaten.
Okay, yes,
Uh
for the sugar test.
yeah, for sugar, right?
Yes, you
Yeah,
have not
yeah.
eaten.
Yeah,
Yes.
you said something like that. It's good to do your sugar test when you haven't eaten. Yes, you said something like that. So this morning, I know somewhere and I started it's the best time to
Really?
go.
You've not started your day.
Yeah, like bro have. Some good time in the year.
Mm-hmm. Okay.
Yeah,
Yes.
yeah, yeah. So you can go to the clinic right there, they test your sugar, you go there, they run different tests, and where your eyes got issues, go there, the doctor will also educate you. Bag riders, you continue to. And the baker, she asked a question. She been baking for more than 30 years.
Yes.
Yeah. And her
Sorry.
eyes been exposed.
Yes. So, yes, heat affects the eyes. You need to protect your eyes, ma. And I believe you are not young, you are elderly. So you need to reduce or limit your exposure to heat because heat affects the eyes. Maybe Mr. Rennie, maybe as we go along with your question, I think you asked me something about Terry John. Yes.
Yeah,
Exposure to
yeah, yeah,
heat.
yeah, yeah,
Yes.
yeah. So
So,
let's get to Terry John quickly. Yeah,
okay.
let's get to Terry John. They are teaching a full aqua show. I thought Terry John teaching it. I pay attention. Okay, let's go. Let's go. Let's go to Terry John. I tried to check him on my notes here. Okay. I
All
tried to check
right.
him. Yeah, the teacher. Yeah. Okay, so yeah, yeah, Terry John. Yeah, you thought about Terry John. But firstly, for those who just listening to us for the first time, what is Terry John there?
Okay. Pterygium is a fleshy growth. All right.
Yeah.
This white portion of our eye, it's supposed to be clear.
Okay.
But for some people, you see something like a flesh red growing on the white portion of the eye towards the black portion. That is what a lot of people call cataracts, Mr. Rennie. That is
Okay.
what a lot of people call cataract. Dear listeners, if you are having a fleshy growth on the white portion of your eye towards the black portion, or you know of someone having that growth, it is called pterygium, not cataract. Okay, it's called
Terry
pterygium.
John.
Pterygium is not an infection. Pterygium is caused as a result of our environment. Okay, over to you, Mr. Rennie.
All right. So the way she been baking, exposing her eyes
To
to
heat.
heat.
And I believe she does delivery. She also goes to the market to buy her the things she needs to
Yeah.
use to bake.
Yeah.
But are constantly exposed to
they're wishing for. And don't joke with your eyes. Your eyes like the field mirror to your entire body. Yeah, that yeah. So when I let go off, brother, you not be able to see.
Yes.
Yes. So protect your eyes jealously. And I always say, yeah, with all no fear. Always try as much as you can to go for regular treat checkup, go for regular checkups before you totally break down. Today we learned that diabetes can affect your eyeball. Today we learned that high blood pressure can affect your eyeball. Today we learned that too much usage of the phone, they can affect your eyeball. The phone light, the computer lights, the tablet lights, the video game light, the PlayStation light. Y'all like I said, and Big Brother Nanja come here again. Y'all sit over the TV bro, in the morning. Y'all look at Big Brother. Y'all be discussing the time that show. The doctor is saying that all of these things got effects on the eye. And as you aging, you don't know. Right now you young, you feel like life is all in your favor. But when you get old, the reality will embrace you and you have to fight it or live with it, okay? So we take few more calls, all right, few more calls, and we need people that will go to the clinic and come on this radio or call on this radio and testify. Let's take few more calls. Hello, hello,
Hello?
how you doing?
I'm fine. I'm dealing with Grandma. I cover from Kelly Jones. That doctor that there, she's my doctor. She's very good. I've been there before. I have asked everybody to go to the clinic and do a checkup. You will get a recommend. For the past 3 weeks, she gave me the treatment. Just ask that she could the people are about it. Grace of God, that clinic is very, very good, brother.
Yeah, Rennie, yeah, that's it.
Very good doctors that telling that six people that you are telling, I don't know how these people are. But I'm Hillary Blama from Broadway. I think from where I went there for the past 3 weeks. I was anxious to get the radio the last week that we looked to them, but thank God, continue. If I have, if I, by the grace of God, God bless me, I will bless the radio, I will bless ourselves.
Amen.
It's a very good doctor that we have found. It's like it's a failure. However, actually, what should be start of intelligence. However, for me, now, after going through the treatment, the way she prescribed it, it's working well. Very, very well by the grace of God. I'm okay. And I appreciate it so much.
Thank you very much, sir.
Let's all more to get more idea, more even no customer. I get more money than you treat more people.
Yeah.
Treatment very, very low. When you're ready, Silo.
Um,
Yeah, very, very low. The infection to test for the eye or 1,500 is very low. I advise all the Nigerians that are suffering from this kind of particular sicknesses, she's talking on the radio, let everybody go there. We should not there. So I think I help let you follow them.
okay.
Thank
all right.
you very
Thank
much,
you so,
sir.
so much, sir.
Appreciate it so much. That's all.
Good morning. Thank you very much, sir. Thank you so much, sir.
All right, Dr.
Mr.
Halima
Ernie,
got to go.
let me
Yeah,
answer the two questions left. I think we
yeah,
have about 2 minutes more. Okay, so
yeah.
Mr. Jackson called and he said, what's the remedy for pterygium? Mr. Jackson, remedy for pterygium depends on the level of the growth. If the pterygium is still small, we can give an eye drop to calm down the dryness and the itching and the redness. But if it's large and it's already wanting to cause vision loss, then the individual will have to go for surgery. Okay, so the options for pterygium is either the use of an eye drop or to go for surgery. So it depends on the level of the pterygium growth. So we can't tell if it's eye drop you will be needing or it's surgery. The other person called for rehab and said he's confused about a lot of sleeping.
Yeah.
A lot of sleeping. Dear caller from rehab, sleep affects the eye. Like I was saying earlier, your eyes needs oxygen to survive. So when your eyes are opened, there is exposure to oxygen. But when you sleep, oxygen has been cut off from the eyes. So too much sleep, I would say again, affects the eyes, okay? It can also cause increased pressure in the eye. Someone also said that his brother constantly uses eye drop. He doesn't know what the eye drop is for. Sir, from the way you explained, it could be that your brother, maybe he's managing glaucoma, because patients that have glaucoma they have to use eye drop for the rest of their life. So please come to the clinic. We will check and know truly what the cause is. Dear listeners, I want to beg you, whenever you go to a clinic or a hospital, it is your health. Ask your doctor questions. Ask your doctor questions. Why am I giving this eye drop? Why am I giving this medicine? Why am I going for surgery? You need to know what the diagnosis is so that you can comply with the treatment or the medications you are being given. So again, our address is at the GSA Road, coming from the main junction, right at the second speed breaker, pardon me, towards your right. You will see the signage, Healthy You Therapeutic Center. There is a dusty road there. When you go in, you would see the clinic. The eye clinic opens Monday to Friday, 9 to 4. But if you want us to attend to you on Saturday, give us a call by Friday so we can plan or arrange for meeting with you on Saturday. Registration and consultation is 1,500 LD. When we are done with the examination, we will tell you what you need. Again, I want to appreciate our sponsor, Lucky, opportunity given to us to be on radio. Now, dear listeners, it is not just about medication, it's also about education. And that is why we are here. And we thank Lucky Pharmacy for the opportunity. So visit any Lucky Pharmacy outlets for your products, your medicines, and your eye drops. Thank you.
Okay, you see, this is why we really need your support and your sponsorship. The program fine, but we gotta go.
Yes.
If you guys were really supporting, who knows? Maybe she could go for 2-3 hours. But folks, time is not our friend. It is our greatest enemy. The next announcer gotta come back on the radio to continue on the day's broadcast with other programs. Until you hear her again, it's gonna be way next Monday. I am appealing to you. Any way you can support her. Maybe she can have 2-3 days on the radio. This program is really, really helpful. Go to the clinic and then do your checkups, do your treatment, run all your tests so that you can stay healthy, so that you can stay alive, so that you can be a part of history making. Liberia is on the move. Be a part of it. See it. See the development. Don't damage your eyes because of ignorance or don't care or too much busy or too much excuses. Until you hear this voice again, it's gonna be another Monday. But maybe if God blesses you this 26th season and you want to be a blessing, you can pass to the radio station or you can visit the clinic. Yes, anything is possible. We can extend our time, we can extend our days. Listen, money answer out there.
Yeah.
Money answer out there. So if you bless her, we can extend the time and also extend the days on the radio that she can come here more and teach. The woman understand her field. She know why she studied. She's not just teaching you, but rather she's educating you on the do's and don'ts to protect your eyes. Until then, bye bye for now.